Namaste, Jai Shri Gurudev. I'm Dr. Sudhindra, Professor of Medicine and Diabetologist from BGS Medical College Hospital, Nagarur, Nelmangala, Bangalore. Today I'll be highlighting upon understanding and managing diabetes. So, understanding diabetes, definition per se, diabetes is a chronic condition where the body cannot effectively regulate blood sugar levels. So, there are various types of diabetes. Coming to type 1 diabetes only is an autoimmune condition where the body does not produce enough insulin at all. So, type 2 diabetes, majority of the patients suffer. Here, the condition where the body becomes resistant to insulin or does not produce enough insulin. Coming to the gestational diabetes, what we call it as GDM. Here, the diabetes that occurs during pregnancy and usually resolves after the childbirth. And coming to the pre-diabetes, here the pre-diabetes, the patient will be borderline and at risk of developing diabetes in future. So these are all the types of diabetes. Coming to the genetic factors, here there will be lot of family history, genetic history, all these comes into play with the genetic factors. Coming to the lifestyle factors, what happens? Lifestyle factor, diet is very important, physical activity important, obesity is important, and smoking, alcohol. These are all comes to the lifestyle factors. So other things are age, ethnicity, medical conditions like obesity, and other comorbid conditions like hypertension, cardiovascular risk factors. All these plays into all these risk factors. Coming to the prevalence, what is about the prevalence of diabetes? So more than 537 million adults of about 20 to 79 age group are worldwide having diabetes, representing about 10.5% of the global population. And by 2045, this number is projected to rise about 783 millions. So imagine the condition of the plight. In India itself is about 101 million. So China, next to China, India will be. So it may beat China also, the presumptions are there. And what about symptoms and signs? The commonest symptoms everybody knows this. We have been learning from our MBBS level. So excessive thirst, that is polyuria, polyphagia, polydipsia, frequent urination, fatigue, blurred vision. So these are all the symptoms. And weight loss, of course, unexplained weight loss is also one of the symptoms. So diagnosis, simple blood test like what we are doing in our hospital, everywhere we are doing a blood test, fasting blood glucose, postprandial blood glucose, HbA1c, and in pregnancy we do a OGTT level, that is oral glucose tolerance test. So these are the things. Apart from that, if there is any complication, we ask a renal function test, LFT, and of course for type 1 diabetes, we ask a fructosamine, C-peptide. Battery of investigations we'll be asking. And how to manage diabetes, this is very important. Managing comes to blood sugar. We have to monitor the blood sugar levels, the importance of regular blood sugar. Nowadays we have glucometers, we have the SMBG tools, we have the Libre, the Freestyle Libre, the CGMS tools. All these various gadgets are available in the market. And medications are simple. We have the oral hypoglycemic drugs, that's oral tablets, and insulins are there, the GLP analogs, various tablets and insulins, and lot of gadgets and lot of medications are there that we need not tell today's topic. Let us be simple today's topic. And coming to the lifestyle changes, what we have to do if you become diabetes? So simple, eating balanced meals, portions, so small portions we have to eat, and carbs we have to manage, little bit carbs and proteins and little bit fats. Fat is very important, that is also basic fat. And diet counseling is important, so we have to have a dietitian also together, hand in hand. And exercise plays a very important. Whenever I tell my patients, 30% is drugs, 30% is yoga and exercise, and 30% is lifestyle modification. So benefits of physical activity, yoga and sports activity is very important. Of course, in our corporate world, everybody is IT, BT, and our business faculty and business people. So stress management is very important. Of course, sleep, stress, all these important. So stress plays a very important, catecholamines and all these hormones will be important, because we're seeing so many patients with have normal blood sugar, but their stress is very high. So the sugars will be not able to control. So then we have to give them insulins and all. So what about the complications? The short-term complications we divide into long-term complications. Short-term complication, like suppose the patient is on insulin, so we have to tell about the hypoglycemia. So there lower sugar or the hypoglycemia. So and the hyperglycemia, that is the DKA, like they came with ketoacidosis and other things like cardiovascular. There will be lot of complications starting from myocardial infarction to cardiomyopathies to pericarditis, the host of cardiovascular things, and of course stroke and neuropathy damage like peripheral neuropathy, kidney starting from AKI to pyelonephritis to you name it, like cystitis. Now post COVID we are seeing lot of kidney complications and eye retinopathy, foot problems starting from amputations to gangrene, lot of problems. So I have put etc. There are host number of complications we are getting. And what about prevention? And prevention, see, early detection can do prevention. We can't completely stop diabetes. We can, there are a lot of gadgets or nowadays coming that we can prevent, we can reversal and all. So little bit like pre-diabetic state we can reverse it, but we can't completely stop it. We can prevent by early detection, that's all. So early detection, how we can do? By lifestyle modification, healthy eating, regular exercise, weight management, and regular follow-up checkups. What we are doing in our hospital, like regular checkups and regular exercise. So that is very important. And importance of regular medical checkups and screening. So we have to do outreach program. We have to do like GRBC checkups, camps, HbA1c camps, and also supportive groups also it should be important. It should involve the local groups and online support systems. So all these outreach park camps or educational material we have to supply for the patients. We have to put some videos like what we are doing, the social media, papers, pamphlets, TVs, all these we have to educate the patient. Education is very important. Still now undetected diabetes is very much common in rural folks. Urban it's okay. So we have to put them on website, books and other information we have to provide. So healthcare providers and insulin also. If the patient is on insulin, we have to teach how to give insulin and we have to train. So we have to train the patient for a healthcare giver like dietitian. So we have to work like a team in our diabetic clinic. We are trying to work like a team, like a healthcare giver, like educationist and podiatrist and all these things we are trying to do. So with all this we can control diabetic effectively. So let's unitedly beat and halt diabetes. So the purposes of this talk is we at BGS Medical College and the Department of Medicine have regular endocrine and diabetic clinics on Monday, Wednesday and Saturday. So I request the community to utilize this service so that we can effectively prevent these metabolic disorder to a greater extent in the larger community. Thank you. Jai Shri Guruji.